Senator, for inviting me to be a part of this discussion. I am Program Director for the Health Initiative for the Eliminating Health Disparity Initiative that Rosemarie spoke about. And I've been working with the community of faith, and it is just unbelievable about what we have learned over the years. As Representative Champion mentioned, one of the big pieces that we're looking at now is infant mortality. We're even in the process of doing an environmental scan by talking with the African American community and finding out what's going on with infant mortality and how we can really address that within our own community. But I'm happy to hear that you're advocating for data collection and also for tracking disparities, because we can't continue to go on in the same manner in which we've been going on. Although it is the health of the state of Minnesota is at a great place, for people of color, we're not seen in the same light. So I'm happy to hear that that's going on, especially for the data collection, even though at times when the data is collected, because this is a small population, as the young lady spoke about, for the Asian, then it's not looked upon as a great need. But because when compared with the general populace, we are a smaller numbers, we still need to take those things into consideration, because when we look at those percentage are much higher for us. The one thing that I also heard you saying, that advocating for the for the workplace and leadership, I think that is essential in addressing health disparity, because if we don't change the faces of those who are in leadership position, it won't really change. We need to be able to hear and to understand where the individuals are coming from and able to hear their stories. And sometimes the person that doesn't look like you sometimes doesn't really grasp the length and breadth of what you're experiencing. So I'm glad to hear about that. But one thing that I would like to see happen as we're talking about leadership and workplace is also to think about our young people. We need to get more young people, directing them in healthcare. And we don't need to start in high school, because that's too late. We need to start much earlier, exposing them to different health careers. And I've always been advocating for that, because I've worked with youth earlier on when I was at Pilot City, now Northpoint. So that's been one of my passions, to see more young people being exposed to health careers. The other thing that I am also have a great concern about when it comes to health disparities, so much that, but I'll just pick a few. One is mental health. In our community, mental health is not addressed. The legislative body identified 8 areas that we would work on on the Eliminating Health Disparity Initiative, but mental health was not included in there. And mental health impacts so many other areas. I mean, it's so intertwined. I tell people that if somebody's depressed, telling them not to eat a piece of chocolate cake will not work because they want to satisfy that need at that time. So even if they're diabetic or they're having high blood pressure, you know, they're going to satisfy those other kind of needs. So it's important for them to address mental health, and it's a big thing in our community. We're just beginning to talk about that within the churches, and we're partnering with other organizations in our community to address mental health. So definitely mental health is one of the pieces that I would like to see included as one of the health indicators. I know it's listed in the 2020, but I would like to see that move up, especially in the state of Minnesota.
You're so right about mental health affecting so many aspects of life. We did a hearing on mental health in prisons, and there are many people in prison who would be much better served, and society would be much better served if they were treated for mental health difficulty rather than having their mental health problem simply exacerbated by being confined. And sometimes people with mental health issues in prison are put in the solitary. I mean, just crazy stuff that we do. And I'm glad you brought that up. Peter?
Yes, I'm the, as I mentioned, the director of the State Health Department's HIV and STD program. And it's a good example of a place where the state as a whole looks pretty good. Our HIV rates are relatively low compared to the rest of the country. But you don't have to go very far below the surface to discover huge disparities. The rates are way higher for communities of color. Among women, it's even more exaggerated. So, for example, for the female HIV cases last year, 27% of them were among African immigrants, and they make up less than 1% of the population. So that's just totally out of whack. Similar story for African American women. The rates are higher, and the proportion of cases is a lot higher. And one of the things that we're going to need to focus on is social determinants of health. There's evidence coming out that those social determinants are a lot more powerful than the behavioral factors. We've got to keep going with the behavioral prevention work that we're doing, but we have to look beyond that because it's becoming more and more obvious that these social determinants play a huge role. So it's about access to mental health, for example. All these things are intertwined. Policies like one of the things that's probably driving HIV in the African American community is high incarceration rates for young black men. You know, that there's a whole range of issues there that we have just begun to explore that I think deserve a lot more attention. And that's a good example. So I think we need to be looking more at policy and structural kinds of interventions, keeping going with prevention work, but looking at things. I mentioned this last night. There's a ban on federal funding for syringe exchange programs. It's a proven, effective public health intervention. And it's evidence-based, it does not promote drug use, and it meets people where they are. And we'd do well to remove that ban. That's just one example. The other thing we need to be doing, I think, as a state health department, and we're actually moving in this direction in our program, is to look beyond our usual community partners. We partner with community organizations and clinics that are involved in HIV work, but we need to look beyond that to get folks in the corrections system involved, to look beyond our traditional clinical partners so that we get more people screening for HIV. Another statistic that really worries me is that every year about 1/3 of the cases of HIV that are diagnosed progress to AIDS within a year. That means they've been infected for somewhere between 6 and 10 years without knowing it, and unknowingly transmitting as well. So we need to do more screening to pick up those cases sooner. And reaching out to a broader range of clinical partners will help us do that. And working with the faith-based community is another area we really need to get going on, because that's a critical element in many cultures, African American, I know, in many cultures. So that's, we just need to be looking beyond our usual suspects and reaching out. So thank you for having us here.
Thank you, Peter. Every word I'm hearing is just gold. Thank you. Prison reform is something I've signed on to, and this could be bipartisan. Senator Webb and Senator Graham are co-sponsoring a real look at we have a dysfunction. We have more prisoners in our prison system than any country in the world, including China. I think we have like half the prisoners in the world in prison. Half prison people who are in prison in the world are in prison in the American system, and this is thank you.
And one of the things we got to figure out is how do we get engaged in that conversation from the public health perspective. It's just one more argument that should be added to the mix, and so that's one of our challenges, and we're looking forward to working on that.
Thank you.